At a media briefing in Abuja by the Presidential Task Force on COVID-19 in Abuja, Mitaire Ikpen reports.
Who had severe underlying illnesses. We have intensified contact tracing, and our strategy remains to promptly detect cases, isolate them, and follow up with their contacts, and also isolate and treat in order to reduce the spread of the infection.
That was the Minister of Health. Now moving on, Nigerians have been advised not to panic or get anxious to be tested for COVID-19 unless they exhibit symptoms, recently returned to Nigeria from overseas, or have had contact with confirmed cases. Minister of Health Dr. Osage Ehanire said this gave the advice said the advice has become imperative as Nigeria, like other countries of the world, does not have the luxury of abundant test kit for coronavirus.
Once they feel feverish or they don't feel quite well, they think it's corona and they want to be tested. So the NCDC tries to discourage people like that. It's not something you acquire like malaria or yellow fever. You have to have meet these criteria. Now, the NCDC at a point had to economize seriously with the test kit, so you don't want to waste it. In fact, at the very beginning, our plan was to send specimens to South Africa because we didn't have the reagents yet. So when we got the first reagents, that's where we could actually test here. In the meantime, we have 6 laboratories, but we're still very careful with the reagents because they are not everywhere available. So we don't want to waste any of them. So you have to meet certain criteria, among which are that you actually have something that looks like symptoms. If you didn't have any symptoms, no, you wouldn't be eligible to test. But again, now it has been expanded to say, well, if you think you have actually been in close contact with someone who was abroad, or you yourself you were abroad and you don't feel well, maybe even if the symptoms are not convincing, you will still be tested. So it's a little bit expanded to accommodate any errors that might arise, or to also put certain people's minds at rest.
All right, I earlier told you that Nigeria has recorded a second death from the coronavirus pandemic. Minister of Health, Dr. Osage Ehanire, confirmed this at a media briefing in Abuja by the Presidential Task Force on COVID-19 in Abuja. Now let's take the reports from Mitaire Ikpen.
With this briefing came an update on the COVID-19 pandemic.
Sadly, another fatality was recorded over the weekend in the person of a patient who had severe underlying illnesses. In addition to the well-known advisory, I am recommending that all families be aware that the elderly among them are the most vulnerable and should be specially protected from needless contact with children and persons who could be positive for the coronavirus infection. The same should be said for all persons who are known to have underlying diseases, such as tuberculosis, HIV, cancer.
Chairman of the Presidential Task Force and Secretary to the Government of the Federation, Boss Mustafa, appealed to Nigerians to cooperate fully with the 24-hour lockdown in Abuja, as well as Lagos and Ogun states, as announced by President Muhammadu Buhari.
It's a total lockdown, except for essential services, except you are going to access specific needs like medical needs, except you're going out to buy food. Nothing would happen to us if we lock down for these 2 weeks and allow for the tracking of those that have been in contact with those infected.
The task force said steps are already being taken to roll out the palliatives announced by Mr. President.
Mr. President's speech on paragraph 54, he has also directed that the conditional cash transfers be given in advance of 2 months. This we have also called the program heads, and we have directed that we start immediate payment of this cash transfer to the most poorest and vulnerable households in our country.
We have deployed about 7,000 of the registered environmental professionals of Nigeria. They are already in the process of disinfecting, decontaminating, advocacy across the country.
In the coming days, Nigeria hopes to expand its present capacity of 6 testing laboratories and 30,000 test kits to combat the coronavirus pandemic. In Abuja, Mitaire Ikben, NTA News.
And to the fact and figures, 20 new cases of COVID-19 have been reported in Nigeria, with Lagos having the highest number of confirmed cases. The Nigeria Center for Disease Control, NCDC, says as at 9 p.m. 30th March 2020, there are 131 confirmed cases of COVID-19, with 2 deaths recorded so far, 13 in Lagos, 4 in FCT, 2 in Kaduna, and 1 in Oyo State.
Meanwhile, Lagos State government has discharged 5 coronavirus patients at Infectious Disease Center, Yaba Mainland Hospital. Nosa Osula reports that this brings to 8 the total number of discharged patients from the center.
Patients who had been quarantined at the isolation center for weeks looked stable and unruffled. The discharged patients expressed joy and satisfaction over the treatment they received. Speaking to the media, one of the patients told people not to panic as the virus could be defeated. While thanking Governor Babajide Sanwo-Olu for his support and proactiveness, they pleaded that the workers at the center should be given life insurance.
I came in here on the 15th. After the test proved inconclusive, I was asked to come back the next day. And that next day, I was admitted alongside of the others. Things turned out to be fine. We were taken care of by the officials, the health officials on ground. And all our complaints were attended to. And now, I'm a living proof, a living witness alongside my other colleagues that we can beat it. We can beat it. And I want to assure others that this is not their home, this is not their resting place.
Because from the second day I came here, there was improvement up to this moment. So thank you guys.
It would be recalled that Governor Babajide Sanwo-Olu had earlier in the broadcast said that some patients who previously tested positive would be released if their confirmatory tests are negative. In Lagos, Nosa Osula, NTA News.
Now let's go back to the restriction of movement order, or you call it lockdown. As a 14-day lockdown in Abuja commences, petrol stations are among the essential service providers expected to operate. Lydia Sampson is on the street now to tell us what the situation is across the filling stations in the Federal Capital Territory.
Thank you, studio. We're at one of the petrol stations in Gudu, in the Federal Capital Territory. And we were told earlier by a medical practitioner who is on his way to Kefi that it is indeed relieving to know that petrol stations are essential service providers, and knowing that they are here makes it easy. And of course, we are told that compliance within the FCT is not an issue, but where perhaps the issue will be is outside the metropolis and even states.
Who the petrol people?
Yeah.
They are not supposed to shut down.
Yes. So how do you feel knowing that they are here?
That it makes the work easy for us. Yes. When we are sure that we can access petrol, the movement becomes easy for us.
Coronavirus now skinning of big people.
Who told you that?
Eh?
Who told you that?
Because you never catch any poor man, madam. That is why they say this one now for big man people.
No, it's not like that. Coronavirus can catch anybody, and that's why you need to be careful.
Okay.
So, and did you people have masks in this place before?
Yes. You don't finish. You don't finish.
It's finished.
Yeah,
then you need to get some more.
Okay, sir.
Thank you, studio. Before I hand over, I'm sure you've heard from Suleiman Bala, who believes that coronavirus only attacks the rich and powerful, and so they can go on with their alive. I believe we need to do more as per sensitization, which I know NTA is already doing. So please, let's remind everyone out there that indeed coronavirus is real. We'll keep you updated even as the situations continue to unfold.
Thank you very much, Lady Samse, and thank you indeed for enlightening that attendant there, for who is believing, or who was believing that coronavirus it's a big man disease.
Of course, I think we are getting more enlightened by the day.
All right.
And now, as our correspondents are all over in the streets in the Federal Capital Territory, Abuja, to monitor the situation of stay at home beginning from today, let's join Oyeyemi Ajayi from APO, who is standing by to give us the assessment and situation from that end. Oyeyemi?
Thank you very much, studio. This is the popular Copacabana area of Apple, which is this place precisely is a popular joint where people actually come to wine and dine. And right from this time, activities would have started commencing. But as it is now, nothing seems to be going on. No one is here. Even you can see of the barbecue sellers, the suya sellers. Nothing is happening. And here, deep inside here, normally you would have started seeing the sellers already trying to prepare for the day, but as it is now, nothing is going on. No one is working except for these two ladies, and definitely they are not coming here to shop, but I think they are going their ways. And on the streets of Apo, you could see the military officers as well as the police already on patrol, out stopping some of the motorists and questioning them about where they are going. In my presence, about 2 people were turned back by the police. This is actually the road that links the Kabusa Junction to Lokogoma, and normally for those that apply these routes well, they know that this place is actually it used to be a beehive of activities whereby you see vehicles going up and down, but as it is now, few vehicles, you can actually count the number of vehicles on the road, and as it is, you can see 1 or 2, and around the Kabusa Junction, you could see at least 3 to 4 checkpoints of police as well as the military on patrol, trying to stop some people who are on the road, who are not meant to be on the road. Definitely, the media are given chances to go on their activities, their duties. In this area of the FCT, they seem to be observing the sit-at-home order by the president. Back to you, studio.
Yemi Ajayi, thanks a lot for giving us that update from the Apo axis of the Federal Capital Territory. Now, this is the news at 10 on NTA News 24.
I'm reaching you live from Abuja. Stay tuned for more reports after the break. Lockdown on Friday, April 3rd, 2020.
The state governor, Prince Dapo Abiodun, made the announcement of the inauguration of a 128-bed COVID-19 isolation center in Ikenne.
Lukman Adefeso reports that the governor, however, maintains that the state will enforce interstate movement restriction as directed by President Muhammadu Buhari.
See, and I asked them to graciously allow us to plan that lockdown. You recall that I had previously announced the closure of our borders effective from last night. But following the president's speech last night, our address last night, I now moved that by a further 24 hours. So our borders will remain closed from 12 midnight tonight.
He had earlier inaugurated 128-bedded COVID-19 isolation center as part of efforts to further curb the spread of COVID-19. 5 ambulances were also acquired alongside disinfectant gadgets. This center at Ikenne is the 3rd isolation center in the state.
And
let's go to Oshogbo now, where ahead of an impending total lockdown of Osun State to contain the spread of coronavirus, the state has commenced full-scale screening of all travelers across the boundaries with neighboring states.
A correspondent, Joshua Ogunjide, who was at the Asejire, a boundary community between Oyo and Osun states, has the situation report.
The fear of coronavirus is the beginning of wisdom. This is why Osun State government, having confirmed the second case of COVID-19, is redoubling efforts to prevent the virus from further spread. The 14-day anticipated lockdown, in addition to the closure of Osun boundaries with other states, therefore becomes imperative. At Asejire, one of the boundaries between Oyo and Osun states, environmental health officials, medical personnel and security agencies are deployed to carry out tests on every motorist and passengers.
The government is not interested in any traveler that will come and pollute the good citizen of the state. And that's why this precaution is very necessary. And at our own end, as law enforcement agents, we want to make sure that travelers are law-abiding.
Anything temperature above 37.5, it will delay the vehicle and the people inside the vehicle. We caught 4 people from China and we sent them back to Lagos.
Quite orderly though, motorists had no choice but to cooperate with the officials.
It's not too bad. As they are doing it, I feel it's very good for the country and for the environment.
It helps this country and it helps masses. Not only even masses, everybody.
From Asejire, Ikoyi town of Osun State, Joshua Ogunjide, NTA News.
As COVID-19 spreads rapidly through many countries, the Central Bank of Nigeria is soliciting for more additional support from well-meaning Nigerians in assisting the government fight the global pandemic. To this end, the Central Bank of Nigeria in a statement said an account has been set up for those who wish to make monetary contribution to the cause, which is 10010014920 Central Bank of Nigeria, while highlighting the efforts of government so far with equipping medical facilities in the 6 geopolitical zones. The Central Bank of Nigeria called for all hands to be on deck to put the coronavirus pandemic to the background.
Now, as of 30th March 2020, Nigeria earned a total of $32.63 billion from the oil and gas sector in 2018, a 55% increase on the over $20 billion recorded from the sector in 2017. This information is contained in the latest oil and gas industry audits conducted by the Nigeria Extractive Industry Transparency Initiative, NTA, which has also announced plans to release the 2019 audit report this year, effectively clearing the backlogs of the audits of the extractive sector and making the reports more timely and relevant. A breakdown of the $32.63 billion earned in 2018 showed that company-level financial flows into government coffers were $16.6 billion, while flows from sales of Federation crude oil and gas accounted for $16 billion. The NTA 2018 audit reconciled payments by 71 companies and the Nigeria Liquefied Natural Gas (LNG) that met the materiality threshold set for the exercise. A total of 8 government entities were also covered by the audit. The report disclosed that out of the $32.63 billion earned from the sector in 2018, the sum of $19.2 billion was transferred directly into the Federation accounts, while $5.2 billion and $4.04 billion were